Sports physiotherapy. Introduction to the module. This module explains the role of sports physiotherapy in the healthcare system and the circumstances in which it can be applied, along with the techniques used. Topics to be covered. What is sports physiotherapy? Types of sports injuries. Physiotherapy treatment methods for sport injuries. What is sports physiotherapy? Athletes and sports enthusiasts typically place significant demands on their bodies and require maximum potential to be squeezed out of every muscle and organ. This pushes bones, muscles, and joints to their limits. Sports physiotherapy is a specialized form of physiotherapy which is designed to treat injuries and conditions that occur during sporting activities or training. They typically differ from other forms of injuries due to the intensity and repetition of movements. Most sports physiotherapists concentrate on one sport and show expertise in the chronic injuries and disorders associated with it and overuse injuries. However, the age and skill levels of the clients are wide-ranged. Types of sports injuries. Most severe sports injuries originate from varying degrees of trauma. They can be separated in terms of the forces that cause the damage. Physiotherapists often classify them as traumatic injuries, caused by macro-trauma. Overuse syndromes, caused by repeat micro-traumas. Traumatic injuries. Traumatic injuries are common in athletics and often attract attention, especially with media coverage involved. This is due to the visibility and immediate impact of the damage, although this makes treatment easier to diagnose. Contact sports, football, rugby, etc., also have their fair share of traumatic injuries due to accidental high impacts. A traumatic injury can usually be noticed immediately and with an easily identifiable cause. Extreme pain and rapid swelling often quickly follow an incident but could still intensify and worsen after a few hours without remedial action or attention. This is why traumatic injuries should be examined and assessed as soon as possible, as the pain level can seriously increase along with associated tissue swelling. This can seriously hamper treatment and diagnosis. Swelling can be controlled just after an injury, and quick treatment can allow faster recovery for an athlete. Overuse syndromes. Overuse syndromes are more complex issues to diagnose and treat accurately. Diagnosing them are becoming more common in sports like boxing and rugby as research and time duration have focused attention on these conditions. Overuse injuries are typically stress fractures and were first officially recorded in the mid-19th century, but they have become more understandable with technological advancements and clinical studies. The injuries themselves are caused by repetitive overloading, a repeated form of stress applied to the body leading to tiny cracks in areas of the musculoskeletal system. Human tissues can be particularly susceptible to injury, especially with other additional elements. This is exacerbated by factors such as personal anatomical anomalies, slight muscle imbalance, bone misalignment, poor training protocols, overexertion, incorrect practices, faulty equipment, inappropriate environment. It is estimated in some scientific studies that up to 25 to 50% of athletes may have to visit a sports physiotherapist due to an overuse injury. This is reported commonly by professional athletes between the age of 20 to 29 years. But amateur sportspeople around 30 to 49 years are also highly susceptible to this condition. Older athletes and sportspeople tend to find overuse injuries becoming more common if they train regularly for more than 2 years. The most widely reported overuse injuries, up to an estimated 80%, originate from 2 types of sports: endurance sports, long-distance running, cycling, swimming, etc. Individual sports involve repetitive actions: tennis, weightlifting, gymnastics, etc. The majority of injuries occur in the lower half of the body, legs, feet, ankles, and heels. Swelling and inflammation are the most prominent symptoms and causes of pain. Injuries to tendons can also often lead to a gradual degeneration of the tissue. When human tissue is injured, the body typically responds with swelling or inflammation. This can be caused by extreme pressure or friction, repeated stress or loads and direct trauma. Trauma often contributes to swelling due to the wound's associated blood collection. Overuse injuries can happen because of repetitive training or activities where normal-sized loads are moved many times. Heavy loads are moved normally. Heavy loads are moved many times. Injuries to bone. Damaging the skeletal system is relatively common during sports activities. They usually transpire while playing contact sports, football, rugby, etc., or playing highly impactful sports, skiing, horse riding, etc. The most typical type of bone injury is a fracture. Generally, a fracture is caused by direct trauma or impact, a collision in football, a fall whilst downhill skiing, etc., causing the bone to break. It can be a severe injury as it can also affect other parts of the body by trapping muscles, tearing tendons, or triggering internal bleeding. The tissue damage caused by a bone fracture can be extensive. Jagged or sharp fragments can cut skin and other types of soft tissue, with the amount of damage being relative to the seriousness of the impact or trauma. A nasty injury can cause significant bleeding and delay the healing process from starting in earnest, compounding the nature of the wound itself. Following a fracture, the irreversible damage that occurs among significant blood vessels or nerves is comparatively rare, but there may still be complications that remain with tissue damage. A fracture to the humerus, arm, bone or wrist can often lead to further complications and considerations. Ligament injuries. The occurrence of ligament injuries in athletes is also reasonably common. These mainly take place in the ankle or knee but can also be often seen in the shoulders, elbows, or thumbs. A ligament can be partially torn with only a few fibers getting damaged, or the whole ligament can be affected. The treatment significantly differs for each one. 1. A partial tear that affects only a few fibers can affect stability. A portion of the ligament may get slightly damaged, whilst the majority remains unaffected. A small portion of the ligament can be torn apart from its setting without displacing any bone. 2. A complete tear affects the majority of ligament fibers present, making the associated joint unstable or unusable. The extremities of the ligament may become detached from connecting systems and the bone itself. The portion of the bone attached to the ligament may become detached from the skeletal structure. Physiotherapists often classify partial tears as a grade 1 tear or a minor grade 2 tear. In both cases, less than 50% of the fibers get damaged, and the joint is considered stable. With a major grade 2 tear, more than half of the fibers are damaged, and a grade 3 tear indicates a complete tear. Muscle injuries. In the human body, muscles and tendons work together as a complete unit. Injuries can occur to the following areas of this unit: the muscle origin, the muscle belly, the muscle-tendon junction, the merge point of the muscle and tendon, the tendon, the connection between the bone and tendon. Muscle injuries are more common at the muscle-tendon junction, which tends to accumulate stress during exertion. Sportspeople can experience muscle ruptures. If a muscle splits and there is bleeding, this can cause a delay in the healing process. This might hinder muscle fiber connections, making a quick recovery less likely to happen. Healing occurs naturally if the bleeding is controlled immediately. Physiotherapy treatment methods for sport injuries. Compression. Compression bandages are designed to apply a measured amount of pressure to the area of bleeding, allowing the body's natural resources to stop the bleeding quickly with its hemostatic capabilities. A compression bandage is made from a stretch material that applies gentle tension to a wound. An ice pack can also secure this type of dressing, merging the positive effects of compression and cooling effects in one treatment. When an injury cools down or stabilizes, the compression bandage is replaced by a normal dressing or protective cover, usually around 48 hours of the incident. Cryotherapy. Many physiotherapists use cooling agents or cryotherapy for proven benefits with some injuries and conditions. As mentioned in the previous slides, soft tissue injury leads to pain and swelling if the bleeding is not mitigated. Less bleeding also results in less scar tissue forming and a faster recovery. This is why medical professionals alleviate bleeding limbs or wounds, advocate rest, and apply compression. This allows hemostatic functions, blood coagulation, clotting, etc., to control excessive bleeding naturally. This is also a benefit of the application of coolness to the injury. Controlled cooling of body tissues can quickly alleviate extreme pain or discomfort from an injury, promoting a feeling of well-being in the client and allowing a faster recovery in general. Encourages the affected blood vessels to constrict, so that blood flow is minimal in the area of excessive bleeding. It should be noted that the overall effect of this type of treatment is limited to a single area, and it takes about 15 minutes before the client experiences any real benefit. After this period, the swelling and healing processes improve. A physiotherapist normally applies cryotherapy treatment for only around 15 to 20 minutes in a single session with typical injuries. Therapy can then be used on an hourly basis, usually by the client, over the next 1 to 3 days. A client generally experiences 4 phases during the treatment. 1. Significant coldness. 2. Slight burning. 3. Dull aching. 4. General numbness. The practical use of cryotherapy provides particular benefit to sports injuries due to rapid response to treatment, an easy-to-understand process, a risk-averse principle, the use of inexpensive materials. Thermotherapy. Medical usage of heat-based treatments have been around for most of the time in humankind history, but physiotherapists mainly use thermotherapy to combat pain and inflammation. This is most typically effective where the body has started to show signs of swelling around an injury because of trauma or stress. An injury caused by trauma, stress, or overuse, muscle rupture, ligament tears, etc., is often initially treated with cryotherapy, cooling agents, in the early stages to limit the bleeding or pain. After around 48 hours, or once cryotherapy treatment has ceased and the potential of excessive bleeding has been eliminated, forms of heat treatment can start. If thermotherapy is commenced before that time, the blood vessels can expand again, and there is a chance of increased bleeding or hemorrhaging. Needless to say, this is not advisable timing by a physiotherapist. One of the most significant parts of heat-based treatment is how it affects collagen fibers. Tendons are mostly comprised of collagen fibers, and overuse, or stress can cause them to become stiff and less flexible. The application of heat to human fibers increases the flexibility and elasticity in fibers. This means that tissues like tendons are more susceptible and capable of exercise and rehabilitation activities. Similarly, the controlled application of heat can also restrict sudden muscle spasms and alleviate stiffness in human joints, reducing the risk of further injury. Therefore, heat is an excellent way to promote the recovery of some tissue injury and prevent similar occurrences during training or rehabilitation. It can prove to be an invaluable way of warming up during exercise sessions and competing in cold weather conditions. Ultrasound. Ultrasound is defined as the sound waves of high frequency that cannot be heard by the human auditory system and can penetrate surfaces to a greater degree than normal sound. When a controlled ultrasonic beam is directed to travel through tissue, heat is created by the absorbed energy. This sound energy can produce temperature change in human tissue up to 4 inches, 10 centimeters, deep, making it especially useful for muscle and tendon injuries or symptoms that lie below the surface of the skin. A physiotherapist invariably uses ultrasound treatment to increase the flexibility of collagen fibers and decrease the pain felt by internal injuries. Stretching exercises often accompany this. TENS machines. TENS stands for transcutaneous electrical nerve stimulation, the application of which can help a client to control their levels of pain and discomfort. Weak levels of electricity are delivered to a chosen area of the skin with electrodes. The effectiveness of TENS treatment varies depending upon the circumstances. It works by simulating a pain-filtering mechanism in the spinal cord, which stops uncomfortable feelings from accessing the brain. Massage. The simple act of physical massage with the hands can be enough to stimulate muscles, reduce swelling, or alleviate pain. Physiotherapists often call it soft tissue mobilization, and it remains a valuable form of therapy. Summary. This module has covered the following points. Sports physiotherapy is considered a specialized area of physiotherapy dedicated to treating sportspeople's injuries. Most sports injuries are caused by trauma originated from traumatic injuries or overuse syndromes. The nature of a significant traumatic injury is usually evident, and this allows for quicker diagnosis and treatment. Overuse injuries generally transpire when microscopic injuries occur to the musculoskeletal system after intense or repeated stress. Soft tissue injuries require immediate attention to stop bleeding and preventing further swelling and pain.